Nurse Chris again. Today, what we're going to be doing this time is administering IV medication by means of the Piggyback system. First thing we're going to run through here is our doctor's order to make sure we know what we're doing and why we're doing it. Physician's order calls for Rocephin 1 gram IV daily as directed over 30 minutes. Available as 500 milligrams per milliliter. Once you compute the math here, you're looking at 2 milliliters to run at 17 drops per minute. The safe dose is 1 to 2 grams once daily. The Rocephin binds to bacterial cell walls, causing cell death, cephalosporin third generation. The treatment is used for UTIs, skin infection, and respiratory infections. Side effects include GI upset, fever. It's contraindicated if you're allergic to penicillin, cephalosporin. You can't hang with a calcium IV. You're going to watch with, you can't use it with hepatic and renal disease, anaphylactic, pregnancy, breastfeeding. The labs to be assessed are liver and kidney functions, AST, ALT, BUN of 7 to 23, and creatinine of 0.6 to 1.2. I've checked the book, his chart, he's good, all these things, we are good to go. Here is my drug card that I've used to show my math, and now what we're going to do is we're going to get our medication ready. I have a solution here of sodium chloride that we're going to mix our Rocephin with. We're calling for 2 milliliters of the Rocephin to go into this bag. Before I uncap that, aseptic technique, right? So let's take our little thing here. I got my medicine, my Rocephin, and I need to clean that cap. Pull back 2 milliliters, pump in my 2 ml of air, and then I can get my 2 mLs of medicine. All right. Now, once we've done that, we're going to take our solution here of the sodium chloride, and we are going to get this medicine into the bag. Remember asepsis, right? So we're going to clean this port. We're going to make sure it's good. Looks good. And in we go. Sharps, right? All done. Okay, now we're going to mix the solution so it's a nice even mixture there. And okay, at this point, what we are going to do is I have my medication label here that we're going to put on this bag so anybody can walk in at any time and know what's going on, because it says right here what it is, when I hung it, any expiration dates, anything that's important here, right? That's going to go on the label. So now that I've labeled my bag and I have my medicine, now I can get to my tubing. So I'm opening this package. Whoa, yeah, right? Before I open that, let's go ahead and wash hands, right? I'm going to attempt to put on gloves for the several time today. I hope they go. Look at me. All right. Okay, now I can get back to my tubing. Alright, so here's the tubing. It's a little bit smaller for the Piggyback. Here's your solution. We can take this cap off here. I didn't put it in yet. Clean, aseptic. Clean. Good. All right. Now, we can get to business here. We're going to take this. What we're doing right now is we're priming this tube, right? So you know what? Go like this. Right. Okay, so basically to prime this, what priming means is we're trying to get all the air out of the tube, right? Let's just squeeze these things. Oh yeah, look at that. That's pretty cool. All right, so now we're clamped off, we're primed, we have no air in our tube, we are good to go. The next thing that I need to do is explain to the patient what it is that I'm doing. I need to do my patient identifiers, right? Always two of them. I'm gonna talk to the guy, Mr. O'Reilly. Let's go with this time, Mr. O'Reilly. The wristband also O'Reilly, and the birthdays are good, and he's confirming everything, so I know that I have the right patient. I want to establish that he's not going to be allergic to this medication. You're allergic to Rocephin? No, you're not. Good. We can move forward. Okay, so the next thing that we're going to do now that we've explained everything to him is we're going to go ahead and inspect the site here and make sure that everything's good. It should be good. Keep in mind that this is a piggyback video, so he's already got an established line where he's got his IV solution already running. But I'm looking at it and it looks good. He's not reporting any tenderness. Everything seems to be good, but it's always good to check. At this point, we're going to take the solution that he already had running, and we're going to lower it. The primary, as they like to call it, huh? So we do this because what happens here is just the gravity, the way it works, and the top one's basically going to drain, and that's why we lower the one that he's got. So now that we've done that, we're going to clean. We're going to clean the port. We're going to clean the port here, because this is where we're putting it. Here's the port. It's clean. Here's this port. It's clean. Now we're going to go ahead and connect it. Now, because where we are connecting is above where the clamp is, reading through this guide you guys gave us, I don't need to clamp the primary is the way I understand that. So I haven't started anything running yet. I want to establish the flow rate, which we discussed earlier was going to be 17 drops a minute. So I'm going to reprogram this. We've run the tubes through the things, and reprogramming this to 17 drops per minute. And at which point I can go ahead and undo my new solution here that I've hung, the Rocephin, undo the clamp, and now after programming this, I can assume that my Rocephin is going at 17 drops per minute. At this point, I'm all done for here and now. I'm going to take my gloves off. I'm going to talk to Mr. O'Reilly and make sure that he's good. He doesn't need anything. There's nothing more that I can do with him. I am going to unglove, wash my hands, an alligator clamp. I don't know what it is. I don't have one. Now I'm done. I'm expecting this to run for 30 to 45 minutes. I'm going to go attend to other patients, and I'm going to come back. But Mr. O'Reilly knows that he can go ahead and buzz me if he needs me sooner than that. We're going to assume that the time has passed by. I'm back to check on my patient and see where we're at with this piggyback med that we hung. I'm coming in. I'm seeing that it's just emptied as it's supposed to. Everything looks good. At this point, we need to get him back on his regular prescribed fluid that he had going on before I came in here and did this order for the Rocephin. And to do this, we're basically going to clamp off the new med. We can disconnect it from this port. And all right, this is funny, right? We all like to laugh. Okay, so now I can take off the med that ran. I can undo this. I can put this back here. This is the original med, right? We're going to run it back through the thing as it was, and I know that it was running at 100 milliliters an hour, so I'm going to put him back to 100 milliliters an hour. At this point, I can go ahead, clean up, re-inspect, make sure Mr. O'Reilly doesn't need anything, and there's nothing more that I can do for him today. And I can dispose of all my needles, get my trash out of here, and we are headed back to the MAR. We're headed back to the MAR, where I'm going to record the time, the drug, the route, the state of the IV site here, and record the volumes of the input, so we have our input and our output, and we know where we're at as far as possibly retaining any fluids. Thanks for watching. 4 Ps. You good? He's good.